The chair now recognizes Dr. Murphy for 5 minutes for any questions you may have.
Thank you, Madam Chairman. Got a lot to cover real quick. Dr. Schulten, you said you practice, correct?
Yes, I do.
What do you do for TBI and PTSD patients who have basically failed your cut and cookie cutter approach to just TBI? What do you do when people come to the end?
Well, I personally, in my clinical practice, again, as was mentioned earlier, do a thorough history and evaluation, come up with a definitive diagnosis, and then develop an individualized treatment plan. That plan considers what interventions, first it considers which symptoms are most problematic for the individual veteran based on their functional ability, their ability to work and access the community. And then we discuss what interventions have been tried and what other opportunities.
Let me just get to the chase. What therapies do you offer these people that basic therapies do not work?
Well, the therapies that are most commonly offered are the standard rehabilitation therapies of physical therapy, occupational therapy, and speech therapy. It's critical to encourage or to evaluate the impact of mental health conditions and then offer appropriate evidence-based therapies to help with any diagnoses such as PTSD.
All right, so let me just get to the chase. At an end, we get to the point where there's not really much that we offer to patients, and sadly enough, this is the part where suicide, this is the part where tragedy occurs with family, and I think this is where, personally, I think the VA is failing to come into the 21st century and understand that there are modalities of treatment. Are you by any chance familiar with the work of Dr. Shai Efrati in Israel with HBOT and PTSD? The voluminous work that he has with trauma, with PTSD using hyperbaric oxygen?
Yes, I've read some of those articles.
And your opinion?
My opinion, along with that of VA and Department of War, is that after thorough review of evidence on hyperbaric oxygen therapy, while there are a number of studies that have happened, the guidelines, current clinical guidelines, don't find sufficient evidence to offer HBOT for use of TBI. Are you
familiar by any chance with the work of Dr. Joseph Marone at the University of Pittsburgh, who does the same work?
I'm not familiar with this
work. All right, please, if you will, for professional education, please familiarize yourself with his work. I'd like to submit for a record a meta-analysis done in the Frontiers of Neuroscience in October of 2023, talking about the multiple studies that show hyperbaric oxygen for veterans, for PTSD, shows an improvement not only in clinical data and clinical wellness, but in physiological achievements.
No objection.
You know, the American Academy of Pediatrics, in my opinion, was negligent in the fact that they created an institution, a generation of children, now adults, who are allergic to peanuts because they refused, through their hubris, through their arrogance, to go back and see data was wrong. They, for 20 years, did not go back and do this. Same thing with NIH, with the fact that we deprived women of getting Premarin, an estrogen replacement, increasing cardiovascular disease, bone loss, and so many of these other things. I believe the VA is being absolutely negligent and still living in 1950s and 1960s and 1970s science and not looking at real data in an era where we are failing our veterans that are, in my opinion, conducive, presenting conducive environments and allowing our veterans in an environment that it creates for suicide, because we are stuck back in saying that we're not right now. The VA may have had data back years ago, but look, I want you personally to read this paper. The VA is being negligent in not allowing veterans access to this treatment. In North Carolina, there's an institution called HBOT for Heroes. They've treated over 250 veterans with, in my opinion, my clinical objective opinion, because I have scrubbed this data, because as a surgeon, I am a skeptic first, that they have helped a tremendous number of our veterans where nothing else worked. So I'm tired of the cubicle captains at the VA still repeating the same rows over and over and over again, saying this doesn't work when clinical data shows otherwise. You guys have a duty to our veterans to stop this massive suicide rate when we can intervene. That, I'll yield back.